Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. As you know, I'm in Burrowang in New South Wales, 2 hours southwest of Sydney, and it is just gone 10:30 in the morning, Thursday morning. It gives me great pleasure to welcome to the studio Tom Larkin, who is in Lexington, Kentucky. Tom, what's the time there?
So we're talking about 8:30 p.m.
p.m. the day before on Wednesday. Well, Tom,
Right.
Welcome to the Ultimate Dental Podcast. Great to have you.
Thank you. It's an honor to be here.
Now, we haven't met before ever, so this is like speed dating almost.
Okay.
We've just had a half-hour brief introduction. We got on fabulously, and that's always good. You and I have been practicing dentistry, or we're of about the same vintage. But as I mentioned, I had to pull up stumps because of arthritis in my hands 8 years ago. I enjoyed my practice, and 28 years in the one location. But you've been telling me that dentistry is changing, and dramatically it's changing on a day-by-day, week-by-week basis. And I like following that because, as I used to think, there were dentists who were panel beaters, tooth panel beaters, and there were dentists who looked at the whole body, but it's even getting more than that now. So tell us what's happening in dentistry today and the new things that you're seeing around.
So let's talk about the traditional medicine and dentistry, because I lump them both together. And they're pretty much a 90% market share of what I call the reactive model. A tooth breaks and someone comes in and you fix it. You have a cold and you go to the doctor and get a prescription. That's a reactive model. 10% about has been a preventive model. Now, there's not a lot of money in prevention, so it's always been a difficult thing to promote, right? And that the history goes back decades. And I had the good fortune, it was 1989 when I got very disenchanted with private practice because there seemed to be just an endless amount of disease. Everybody had cavities, everybody had gum disease, and I heard about a very controversial figure named Dr. Paul Keyes, at the time was at NIH, and he was the one that really figured out the concept that this is an infection. And he was much like the fella in Australia about the ulcers. He was very controversial too, and he ended up being right that ulcers were not from stress, that was bacteria, right? So Dr. Keyes was very misunderstood, but I brought his protocols back into my office, and it was looking at the microbiology. We had a microscope, we had an incubator, we tested for bacteria. It was like, wow. And these patients got better. And I had no idea at all that there was a systemic component to this, right? It was basically, I just enjoyed people becoming healthier. And that became something I became very passionate about. So fast forward to about, it's 10 or 12 years ago, I meet Dr. Brad Bale, who is a preventive cardiovascular guy, and he started talking about all the implications of the mouth with the rest of the body. And I was like, wow, I need to get in this conversation. So I I wrote a book on this whole thing. And then I started to hold conferences and then everything. So what I really want to bring fast forward is a conference that I had last April. And everything that's happened around that in the past 60 days is just absolutely amazing. So one of the things that I recognized last fall, and this is not political in nature at all because I'm not a political person, was that we had a change in administration, but most importantly, there was a change in focus. Okay, so here are the components. We have an economic catastrophe, which is our healthcare system, which is bankrupting the company. We have a political mandate. It is what it is. And it says that we need to find money through prevention. So all of a sudden, I hear this word prevention come up. And so I did something very unusual. I invited founding members of the task force, Senator Kennedy's task force, to come to my meeting. And I reconfigured the meeting, and I brought all these experts in prevention in. And I just wanted everybody to meet each other. That was it. I also had the dean of a brand new dental school that's being deployed in Eastern Kentucky. And it was a very, very special conference. So as a result of that, in the past month, I got to testify in front of the Senate. You'd have to know me to know that this is an out-of-body experience, because I'm not that person. But if it was not me, it was who? The dentist wouldn't be there. So I got invited to the first meeting of this task force. Now, this is a state legislature. And and it's just like you see on TV, you got the microphone and the senators and everything. And basically the conversation that I focused on, I had 20 minutes because I wanted to talk about carbohydrates, sugar in the drinks and things like that. I said, let's go for the things that are obvious. We hear the word common sense a lot today. Let's do the common sense things first. I don't want to get in a rabbit hole on other things, right? It was really, really well received. But here's what happened. After that, they started to ask me for personal recommendations, or I need a dentist to go to, right? So when I left the university to pursue this track that I'm on, I did about 6 startups, scratch starts. And I have a long history in startups and acquisitions. And this is in our immediate area. And one of them is a holistic practice. And once again, I'm not a holistic dentist, but I assisted this young dentist. So I'm observing a practice that is 6 years old and really encompasses this whole thing of the whole body connection or whatever. Well, the practice is closed to new patients, does not accept new patients, and there's a waiting list. And there's not only a waiting list, you have to apply to get in. And it's just an extraordinary model that has emerged. Now, it's not me. I'm her coach. I helped her through all of this stuff, but it's not me. And so no one can get in to see her. And so when these senators were texting me, they wanted to be seen by somebody who did a salivary test. And I'm like, well, I've been training people now for years, but I coach maybe 2 practices a month. I mean, it's not like I don't have the tens of thousands of people that you need, that you want right this minute. And so it hit me just almost immediately that the general public is looking for health solutions, self-empowerment. Because our health system is broken, you can go online now and you can get your labs. You can order labs, get interpretation by a coach, right? For your medical stuff. But the dentists are not represented in this space at all. And I really saw how underserved this was. And so it was kind of a frustrating experience, but it was an enlightening experience that really changed. So what is the barrier? What is keeping dentists from moving off the dime? As you know, because you're an expert in practice management, the hygiene department is about a 1/3 component of the practice. And really right now, there's a tremendous amount of turmoil in that space for a variety of reasons. And it kind of began during COVID, but it's kind of an ongoing. So we have these models, DSO models, acquisition models, where hygienists see a lot of patients very efficiently and very fast. I call that the speed up model. Then you have the practices that are slowing down, that are really tuning into what the consumer wants. And I'm trying to break down that barrier. So here's the barrier. The barrier is the word holistic. And I didn't know it. Okay. Holistic has always been, and I know this because I'm an old guy and from a long time ago, that was always a radioactive word. Those were the foil hats and kind of crazy people. But to the patient who goes to Whole Foods or Trader Joe's, holistic to them means it's better for your health, right? So the dentist, as soon as they hear the word holistic, they close down. So 95% of the dentists will close down. If you see a post on social media that says fluoride is poison, they shut down. Okay. And so I went into ChatGPT and I said, break down the practice of holistic dentistry to the list of services and the impact on health. Fluoride was 5%. I was like, okay, we're letting a 5% issue dictate the conversation. Okay, we're doing that in politics. I'm sure they're doing that in politics in Australia. They'll take so it's called disproportionate focus. I looked that up too. There's a word where a small issue becomes, because of amplification through social media or whatever, it takes over. Periodontal disease, which is all that I've taught at all, that's my only lane, is a 70% factor. Okay. So I'm like, how do we get the dentist to do a better job of treating periodontal disease, which is a 70% factor? And I don't want to talk about fluoride, and I don't want to talk about root canals causing breast cancer, because those are just crazy outliers, right? How do we do a better job of that? So it's never became more apparent to me what my mission is, and it has a lot to do with semantics and how we position things. So I have this conference that I started. It's called Oral Systemic Mastery, and what I did was, and once again, completely hygiene. I just kind of fell into the hygiene thing because I had an extremely novel department, super productive. They made and this is a long time ago. I figured it out myself a long time ago. And so I'm comfortable with that. And there's a lot of discomfort in this space right now, the whole hygiene space. So I want to find a way to better help everybody kind of have this conversation. So where we need to start is what do we have in common? What is our commonality? Well, our commonality is we all want to help people get healthier. Okay. What is our distraction? Well, the distraction is the mechanical, the engineer part of us wants to do AOX, all on X. That's $60,000 a case, right? I want to learn the digital workflow. I don't want to teach somebody how to brush their teeth for a couple $100. Okay. So now we have to deal with that. Okay. And that's been since the beginning of time, this conflict between, purpose-driven people who look at dentistry differently. They have a different view of dentistry as far as helping people, as opposed to the engineer who gets great satisfaction out of working in tight spaces and low tolerances and fixing things, right? So that's how I got to you today, because I really wanted to talk about this. It's a really interesting thing that's happening.
Well, I think from what you've said, Tom, it's the difficult part is that your audience isn't the audience that you want, the dentists. They're not receptive to reprogramming their brain to what they should really be doing, which is helping people with their health, as opposed to fixing things, fixing broken teeth. They're programmed to look in the mouth and see what's broken and tell people what's wrong all the time.
Yes.
As a practice owner, I said, if you're going to call me in to do a hygiene check, talk about every tooth. Even if every posterior tooth needs a restoration, at least when you get to the bottom 6 anterior, say, these teeth, and in our country, we use a world-renowned system for numbering teeth, whereas the Americans just have their own system, kind of like their Super Bowl. But, I'd say 3-3, 3-2, 3-1, 4-1, 4-2, 4-3, all okay. So at least that patient doesn't think that every tooth in their mouth is bad. So that's the trouble. Dentists, and I hate categorizing people as being dentists. Dentistry is what they do, but sometimes what you do, it's like that Rick Moranis character in the Ghostbusters. Yeah. He was an accountant. Every person at his party was a client. They get focused on what they do, but really, you're right. They've got to switch that brain off and talk about people's health. And there's so much health in dentistry, not just the orosystemic link, with saliva and the indicators in the mouth that indicate the health, but even the sleep and the snoring like that.
Yeah. Oh, 100%. To me, that the two big things here, and I talk about not getting into rabbit holes, it's gum disease and sleep. Those are the two main. I mean, you're going to get your most impactful traction in health there. We can get into failed root canals, and we all know some root canals fail, but it isn't, it's not up here. No. It's, can you breathe and do your gums bleed?
True. Yeah. And, I remember somebody saying to me, dentist, he said he would say to patients, if you washed your hands and your fingernails started bleeding, you'd be straight to the doctor. But you brush your teeth and you spit out blood. Well, it's just a little bit of blood,
100%. So I think you just hit on a key point. So what I want dentists to know is that you have a predisposition that our patients need to be educated, And I'm here to tell you, forget it. The patients know more than you. They are looking for people that know, because they're on Dr. Google and they're out on AI, and they're looking for solutions. And one of the most distressing things you'll ever do, and I tend to lurk a lot on Facebook. I joined a couple of public groups. One of them was on holistic dentistry. It was terrifying. because it was people, there's nothing worse than novices advising novices, whether it's a dentist or it's someone from the general public. It's horrifying. If you really want to lose some sleep, go onto a Facebook group of on dental implants. And then once again, these are patients. Hey, I'm getting it all on X. What's your experience? Hey, I'm going to Turkey. Hey, I'm going to Costa Rica. Whoa, 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 whoa. And it's just happening. Okay. And once again, what I've learned from lurking in those groups is that patients want to be listened to. And I think you know this from your level of experience. When patients get frustrated, and I think patients, from my understanding, is that patients act out a lot more today than they used to. They might be more inappropriate, but their desire to be listened to. Okay. So when I talk about a model where we slow down a little bit and listen and create relationships, and you know how important relationships are. So any model, whether it's a DSO or whatever, where we speed things up under the name of efficiency, and you see that the groups that are all about EBITDA, ROI, efficiency, they're not working. They're not working. You can't go faster. So we need models where we can go slower. And so this is where I see AI coming in, because everybody says, where does AI fit into dentistry? And once again, you and I have different lenses because we have decades worth of experience. If you've been in practice 10 years or 15 years, what I love is that when Facebook and all that social media came along, people of the generation thought that they owned it. But you looked at it and I looked at it and said, oh, I know what I can do with this, right? Because I have experience. But they think they own it because it's theirs, right? No, 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 no. So you think you own all this information and EBITDA and practice management, KPIs and all this stuff. Forget it. It always comes back to relationships and understanding who our consumer is. So our consumer wants to be heard. Our consumer cares about their health. They want a dentist. Ooh, boy, look out. They want a dentist who at least understands salivary diagnostics. You don't have to get way off in the weeds, but I have an infection. And if I go to a medical doctor, he looks at an infection with a test. He doesn't look at it with a naked eye and say, looks better. He tests for it, right? So salivary testing, as the American Dental Association, as of June of 24, actually endorsed salivary testing and said, dentists need to learn this. And next year, there's going to be some codes. I'm not current on ADA codes, but there's going to be coding around testing. What a concept. Market share is still less than 10%. So when people are struggling in practice and they're looking at potential, and they're saying, well, I need to be number one in Google My Business and all these strategies, and I've got a 10% marketing budget, and everybody's chasing the same thing. I just call that, dentists are so susceptible to what I call lemming, the lemmings that all kind of run off the cliff together. That's your average dentist. They just all run together off of a cliff. And then I have a 5-year practice where the door's closed. Then you have to apply to get in. Excuse me? What can we learn something? Is there an in-between? Okay. What can we learn from these outliers, these people that I've coached that have extraordinary practices, the slowdown model, and the DSOs are not going to take over. They're not going to take over. They're running into, and I'm sure you know this because you've talked to David Phelps. You know some smart people. They're running into issues. They're running into financial issues with private equity acquisitions, and that stuff all looks good on paper. And when you get down to when the rubber meets the road, it's human being, and human being, right? It's relationship. And that stuff doesn't scale. It's hard to scale.
It very much is. And you're right. When roll-ups, as they were known, came to Australia, I was ready to sell my practice, and I was ready to sell it to a roll-up because it was one of those practices where you couldn't get the value if I sold it to another dentist. Whoever's going to buy my practice is going to be able to build that for themselves at less cost than buying it off me. I knew roll-ups were going to come to dentistry because they'd come to medicine before that. And I had a good friend who said, he told me what happened when his medical practice got approached. And I thought, it's got to come to dentistry. And it came in my lifetime, thank goodness, because my biggest fear, Tom, at that point was, I remember a friend of mine dropped dead in his practice, age 58. He had a cerebral aneurysm. And I went and visited his wife looking to acquire his practice because it wasn't far from mine because I was into acquisitions. And it was like watching The Price is Right, that little man going down the mountain and the value going down every second I was talking to her because he wasn't there. The key man was gone. I said, I can't do that to my wife. I can't do that to my family. I've got to get that asset out. And I did that. But in that process of selling and watching the roll-up company, because they were going to float it, And then thanks to, I think the .com crisis, the stock market tanked, so that didn't happen. So they found a buyer, but they didn't really know what to do with them as the key men were retiring after their 5-year contracts. And
Right.
and a lot of those offices where the key men left or retired because they were at selling age anyway, they lost their turnover because it was all about the relationships that they had. And it's disappointing. But as much as you like your relationships sometimes, I found when I left my office, some of my patients that I thought would follow me 6 miles down the road said, look, it's not 6 miles in the direction that I would want to go twice a year. And I went, oh, okay. And then others who I thought would never follow me thought I was the Messiah and did follow me. So it's interesting, but it comes down to how you make them feel. And also if you can, as you say, educate. I always have images of education being like, the schools in Oliver Twist and another brick in the wall, it's punishment. And my mother was a school teacher and a history teacher, so I never did history. But I think giving people, sharing your knowledge and saying this will benefit your health, opening them up to thinking broader, and showing that you are more knowledgeable than what they can find on the internet, or that you're at least saying things to them that they've already read but they haven't asked you about. I think that's really important. But it comes down to knowledge and friendships and relationships. And people will leave your office if they think that you just consider them a number. If you turn up for your appointment 3 minutes early and you're brought in 10 minutes after that and there's nobody else there, it's like, they're taking me for granted. And so they leave. But I love the fact that you're ahead of the game. It's always important, and that's how you grow a practice, is finding something that's happening that nobody else is doing and doing that, or just doing the opposite of what everybody else is doing. That's a Kennedy philosophy, isn't it?
And Dan Kennedy, I've just consumed I find him beyond brilliant. I mean, he's super old school. I love, hearing the stories about the conferences, and they sold cassette tapes in the back and everything. I mean, to me, that's just like, and that's what I was telling you. There's so much value in people like yourself and me who've been around the block a few times. And I hope younger dentists who are so stuck on these Facebook influencers at some point begin to look at history and begin to look at experience and value it more. Because I'm not sure that they do.
Yeah, they don't. And I keep telling my clients, my dental practice owners, that I thought I knew everything at 15 years. And then when I got to 20 years, I thought I didn't know much when I was 15 years out. Every 5 years, I think, well, I know I've learned more in this last 5 years than I did in the rest of my career before. And, I practiced for 35 years.
Yeah.
And
100%.
you'd know that. It's just your life is an education it's a working education, even owning a practice. You learn what you're good at and you keep doing that. And then you learn how to improve on that. And I think you probably heard it. They said, you've got to do 10 implants to be good. And then when you get to 10, they say, no, you got to do 50. And then when you get to 50, they say, no, you got to do 200. It takes time and it takes that skill. And it's seeing the issues. You mentioned about the salivary tests. Now, I did it through my exploration as a coach. I came across the salivary test for oral cancer markers. And I did that test, but I got a 1-hour review with a dentist as a result of that test. I didn't have oral cancer, but I ticked the box that I was a smoker for 6 years of my life, which I wish I never did, but I haven't smoked for 40 years. And that I do enjoy a glass of wine on the weekends. And so they were two risk factors. So that I said, I better do this test. But going through this, it was like a 1-hour Zoom meeting about the other markers in the saliva and talking about, that I had a high risk to caries, but because of my habits of cleaning my teeth and my diet, not a very low sugar diet, it negated that. But for the average person out there, and the scales on this test were from, 1 to, let's say it's 1 to 10, but the red area was like 1 to 7, and the green area was 7 to 10. It wasn't even. It wasn't like 50% pass. It was like 70% pass. So it was really educating. And the trouble was for me that I would have loved that test to have been available when I was practicing dentistry, because it made a lot of sense and it was easy to explain. And so this is something that's come along in the last 2 or 3 years to help people understand that it's not help your patients understand it's not, it's only a clean, it's just a clean, it's not that, it's part of their health.
Yeah. So the most important, my understanding of the most important KPI in dentistry is retention in hygiene, at least in the US. What
Yep.
percentage of the patients engaged, they appoint ahead for their hygiene appointment? Okay, retention. And so this is the example that I use. And the studies that I've seen, I'm just going to throw some numbers out there. The difference between 60% hygiene retention and 90% hygiene retention is double gross income for the dentist. So the two things are intimately related. When those people come in on for the regular cleans, it does spin off restorative work. And so when this thing is an efficient machine, that tends to trickle down, and the dentist needs to understand that. So let me give you the example of the 60 and the 90. So the 60% patient, it happens to be a beautiful spring day. I got an appointment this afternoon. I got to also have an appointment for golf, right? I don't want to miss the golf, right? So they call and they cancel, or they text and they cancel. They have a low value of understanding of this appointment. The 90% person is someone who, in their health history, that has been thoroughly examined, a good health history, and is an insulin dependent diabetic. And they have been absolutely educated to the fact that those regular cleans provide them with a more stable blood sugar. There's a relationship between their blood sugar, diabetes, and their oral health. They are not going to miss, regardless of weather, golf, or whatever. They're in the 90 percentile. So the shift in the conversation and having the time to create that is how you change that metric. It's all about the perceived value and why they come in. If you come in because you like the way your teeth feel smooth, they feel lovely the day after you get them cleaned, right? It doesn't last very long. If that is your total perception, you have a value issue, okay? And you need to explore some of these more advanced concepts that is going to get your schedule so filled that you're going to need another hygienist, and you'll have a wait list. And that's where your wait list comes from.
It's interesting because now I'm retired. I actually go to 2 practices twice a year each. And that only happened because my regular dentist, he had a problem with his hygienist. They just kept getting pregnant, and he was replacing them with dentists to clean teeth. And that's not the same. We all know that.
Right.
I then located that somebody who used to work for me worked for me in Sydney, was working down here 2 days a week, but she had a long wait list of her own. So I started seeing her, and then I thought, well, I'll just go to the, when my regular dentist gets a hygienist, I'll just go there and I'll do it every 3 months or alternate. So one knew that I was going to the other, but not the other way around. It's kind of like cheating on them, isn't it? It's like being unfaithful. but I do it. People say, oh, you must have dirty teeth. No, I've got a DMFT of 4. That's all. I've still got all 32 teeth. I get my value when I get them cleaned, but they do feel so much better. So I'm failing myself there. But I've learnt too, from being a dentist in the one location for a long period of time, that what shocked me was, I would call it mature onset periodontal disease of bone loss. It's bone loss more than periodontal disease. The gums are okay, but all of a sudden they're starting to lose alveolar bone in their 50s. People who've been coming every 6 months. And so that's something systemic that's doing that.
100%.
And it's the old, why do old people get osteoarthritis? Well, why wouldn't whatever causes osteoporosis? Why wouldn't that affect the alveolar bone as well? And I've got gaps. I've got gaps that chicken and prawns get caught in when I eat. There's no cavities. There's where those gaps come. It's black triangle disease. And I brush 2 or 3 times every day, but now I brush first thing I get up. First thing. It's the first thing I do. In fact, I stayed at a friend's house last year because I was visiting. I went to a sports game, and then I was visiting someone, so I stayed at his place, and I said, we'll go for a walk in the morning. He said, on the walk, he goes, you brushed your teeth first thing and you haven't eaten anything. I said, yeah, but that's because I've got a dry mouth from sleeping, and I just want to get it clean as soon as possible. He goes, I never thought of that. So there's a dental lesson from that I gave him as a friend. But that's that continuing education. Again, I didn't know what floss was until I went to university. Even though my mum took us to the dentist every 6 months, I never got shown how to floss by my dentist back in the 60s and 70s. It is nice when the education hits and they get the message and they come with you on that journey. That's always the nice part. But I love that 60% and 90% indicator that you mentioned. And of course we know that for your regular patients who trust you. I can remember diagnosing a crown on a patient, and she was agreeing to the appointment. I didn't even remove the mirror and the probe from her mouth. And she goes, yeah, let's do it. And that's the kind of relationship that you want, that trust from your patients.
So let's touch on the economics just a little bit, because everybody likes to talk about money and dentists want to figure this out. So in the course of creating this advanced hygiene course, and we're creating value, I'm also looking at technologies. Okay. And one of them happened to be the diode laser. And so I've just, these people tend to appear when I need them. And I found a really great expert on diode lasers. Once again, I'm not the master of all this. I just assemble the pieces. Got a great laser trainer, and really became convinced that that is a good adjunctive service for pathogens, oral pathogens, on a regular basis or whatever, especially if you're in periodontal therapy. Now, it's not covered by insurance ever. There's no plan that covers it. And the cost is generally $100 to $200 per time, right? So once again, we have a health conscious patient who says, I don't want these bugs in my mouth. We're showing them the bugs on the TV screen or with a salivary test. And you say, Mrs. Jones, one of the things that we're going to do in your periodontal therapy is we're going to do a laser. And it's probably not covered by insurance. And they don't blink. They don't blink. So I've just added $100 to that visit, which is a lot of money in any PPO scenario. And then we can ozone water. That's another thing. Guided biofilm therapy or air polishing. These are all adjunctive services that you can assemble. And once again, those are all the services that I teach, and I let people kind of assemble them in their own way. But it just, there's value in that too. It's not just the fact that they come back. It's that they come back and they ask for, because they're educated, better service. They want a better level of service. They know that just a really quick polish might not be the best. Why don't you go around there with a laser and kill all the anaerobes while you're at it?
Yeah, you're talking a different language that most people don't understand. Most people think, in fact, I can remember when I was telling you about my shoulder replacement, I had physiotherapy, and my physiotherapist said to me, he said, when I go to the dentist, he said, he always wants to do a clean at the end. Is that just a touch-up that I'm getting from him? Is he just getting into my wallet? Is that what it is? This is one medically trained person talking to another about what's going on. Like his dentist isn't even telling him what the clean is actually for. And I said, no, it's not. And we're talking 10 years ago that I had that operation. So that's the perception from other allied health people sometimes.
Yeah. So much work to do, David. It's daunting, really, truthfully, the education on all levels. So one last thing I'd love to touch on, because this is another emerging, I'm a quote unquote futurist. Okay. And that has to do with the dental implants. So a market share of dental implants in the US placement is, it's like this, right? It's vertical. Everybody's taking a weekend course. It's almost being correlated as a mandatory thing. If you're going to pay your student loans or whatever, you better learn to place implants, whether you like it or not. Okay. So since I've been a professor, I have seen hand skills up front, and I've trained hand skills. I know, and I have also taught students that I would not let them within 20 feet of me with a sharp instrument. Okay. Upon graduation, they couldn't, I wouldn't let them near me, let alone place an implant. Okay. So that being said, Dr. Larkin, the number one risk factor for a failing implant is a prior history of periodontal disease. Okay. If you lost your teeth because of gum disease and you get a dental implant, you have a risk of losing them because of gum disease. That conversation is not being had. So what I'm trying to tell you about is that I'm trying to have the original periodontal disease conversation with teeth. Okay. Now we have very expensive investments by patients in these complex restorations, all on X being the most, the $60,000 roundhouse. And if they have gum disease, the dentists now are on message boards. This is after they place it, right? And I'm like, well, you know what? For a certain percentage of patients, I don't know what the percentage is, this isn't going to end well. They're going to sequentially lose implants due to gum disease, but they may be fairly forgiving if they lose their teeth in front of you, but they are not going to be forgiving if they lose $60,000 that you put in their mouth. and watched it get infected and decline over a period of time. This is a conversation in the next 5 to 10 years you're going to see elevate.
That I love that because you're actually pointing the finger at the less experienced dentist because they haven't been on the journey long enough to
Yeah,
know that these things are going to fail, and so
yeah,
they're just going in gun ho, and then it's failing. I'm of the philosophy, Tom, and you know this. That they say that when someone wins the lottery, there's a good chance that in 2 years all the money's gone, and it's the same. I think it's also the same that if you took all the wealth in the world and distributed it evenly, within 2 years it'd be back in the hands of the people who had it, and the people who didn't have it would have lost it all. And it's exactly the same in the mouth. You've been a dentist long enough to know that you've done full mouth reconstructions on real teeth, and a patient never comes back, and they go, it's too far to travel. And you go, but you've just spent $50,000. It's too far. And it's like, it's only twice a year. It's too far. And so it's the same thing. Whatever caused the problem that you're fixing is going to cause that to fail as well in most cases, unless they change. And they don't change. They sadly think that this is their panacea, but it's not. This is just a speed hump, and they still eat the chocolates, they still drink the sodas, and
yeah,
it still rots their teeth.
yeah,
So we do have a difficult future in that sort of situation. In
yeah.
fact, a friend of mine just came to do. He's a building inspector. He came to do an inspection on my home. I said, we've been here 2 years, and we'd like to know how good it's been done. And he just said, I got the quote for implants, but the dentist said, I'm not doing it in your mouth while you're smoking. He said, because it's just going to fail. So at least somebody's there on top
Right.
looking after him rather than just looking to take
100%.
his money. But yeah, they've got to change. And often if they've been smoking, the lack of oxygen getting to their gums through their blood supply, that'll never
Yep.
change. It'll never change. It's
Yeah.
scary. The best. This is a cliche-a-thon from me today. When's the best time to plant an oak tree? 20 years ago. When's the second best time? Today. We can't turn back the clock on these things, but we
No.
must start saying you need to become healthy from this day forward so that you can live longer, so that you can keep your teeth longer. And also, and let's talk about it now. The mouth isn't just the window to the world. It's actually the other way around. It's not a way. It's not the window to the body. It's actually the same blood in their mouth that's pumping through their gums is pumping through their heart. Infected blood in their gums is pumping through their clean heart, their clean lungs, and their clean organs. How many patients really understand that? Not many, even now in
Right.
2025. And
Yeah. No, I agree. Yeah.
that's a big battle that we can just start educating people. And then once we start educating them on that, and then we say, well, the saliva is also a view of what's going on in your body.
Yeah, it's the new frontier. No, it is, like I said, it's less than 10% now. It has to become a part of this conversation because prevention, I've looked at the government models, the amount of savings is in the trillions of dollars with a T. And if we don't do it, then, it's a mandate. It has to happen. So my premise is, dentists, you want to participate in a market that's going to come to you. You're not, I can't emphasize enough. This isn't a new market you're going to have to cultivate like a garden. The market is there. You need to get trained. You need to shift your focus. And it could be a complete shift or a partial shift, but just participate in this conversation so that a patient feels comfortable that you're looking after their overall health.
How difficult is it, Tom, in the US? Because I know that sadly, and I've seen those color charts of the US regarding obesity levels, and now it's all
Oh,
the whole country's dark blue. And I remember a dentist friend of mine from Kansas saying that the attitude to health from his patients was, well, I paid my taxes. It's up to the government to help me stay alive, even though
yeah,
they punished their body. This same dentist was obese. He would go to the gym at meetings. He would go to the gym in the evening, and then on the way back from the gym, he'd stop off at the store and buy candy and chips and sit up. He said, I made room for that stuff now. So how hard is it to get them to actually concentrate on a part of their body? Now we're talking obesity is a part of the body they can see. They can see their body. There's a mirror there. But inside their
100%.
mouth, how do we get them to be aware that this little hole is actually connected to their body.
Yeah.
So it's and what's in there is telling us about their body. How do we get people to switch that switch in their mind? It's tough.
I think the functional medicine people have done a much better job. I went to a meeting, it's called A4M, which is a very large organization. There were 7,000 physicians. And from what I can tell, there was 5 dentists there. This was last December. And I was like, boy, the dentists are sure underrepresented. Well, the messages of all of these are physicians that have dropped out of conventional practice because they have found it unfulfilling to be on the merry-go-round of shoving prescriptions and pills. And what they've discovered is that they can create a market in wellness, and wellness includes nutrition, obesity, all of those factors and that you're talking about. But once again, I saw the dentist not only being underrepresented, but almost like no representation. So as I interact with functional medicine people and they come to me and say, where am I going to find a dentist? And I say, well, my list is pretty small. I think this is horrible that this is not university based. And that was one of the things that the senator asked me to do. And I submitted to her a 1-semester course of an integration of medicine and dentistry of what that would look like. And that was one of my proposals to their committee and I would be happy to supply the faculty. It wasn't just me. I know many people that would be more than happy to create a pilot program starting to educate medical and dental students, because they're entrenched in this horrible reactive model. It's the universities, it's the insurance companies, it's the hospitals. They're all intertwined. It's a broken system. So if we're serious, and I don't know how serious, but at least I took my personal time to interject at a government level, looks pretty obvious to me, and I'm here to help.
Yeah, I see the issue. I know what the problem is, that all change costs money. Now they do have money. Yeah, like a golf like a golf club. If the committee doesn't spend the money, then they're seen to be negligent. So they have to spend it on something, but
Right.
they can't spend money that they don't have as well. So how do
Right.
they raise that money? And so change for speculative change or
Right.
long-term change isn't going to get them re-voted as well, or re-elected.
Yeah.
There's so much politics in every financial decision. I love that you're trying to open, and you've got this passion to open the eyes to people that there is a better way, and there needs to be a better way, and it needs to be proactive and not reactive. But the trouble with dentistry, this is why we have more universities, is that there are more dentists who can't do what they can do, but they can teach what they can do. And so they give jobs to more academics, and then that just slows, that slows the train down. The locomotive just comes to a stop. And so it's all about creating academic jobs.
Yeah, no, I've seen it firsthand, you're 100% correct there. And it's, for sure.
Change is difficult. We had Ray Bertolotti came down to Australia years ago, talking about the total etch, total seal. And the dean of the Faculty of Dentistry at the time called it total etch, total bullshit. And boy, did he have to eat those words.
Yeah.
He just did, again, that's a restorative process change. So
Correct.
What you're talking about in terms of preventive, that message needs to get out there. And I think, everybody who's watching this and listening to this need to, one, start working out a game plan for your own office, need to start working out a game plan for your friends, because it's only your colleagues hearing it from you that this is what we should do. I remember when I first heard about sleep and dentistry back in 2006, I'm going, what's that? Boy, was I so glad I learnt that, in the end of my career, because it just opened up my eyes to why people got pain that I couldn't work out where it was coming from. And so the information's there, Tom. You're 100% on the right track. We've just got to get more people on that track with you, and just start thinking that, this is a better way of practicing dentistry too. To the fact that you start to help keep your patients alive longer, and you impact on their lives and their children's lives and their families' lives. In fact, I just read on Facebook this morning, and I said to my wife, I said, how long have we been married? And I said, we're coming up to 36 years. I said, this speaker that I saw 10 years ago on customer service, she's about my age. She's just, her husband of 37 years just passed away. And I'm going, he's died young. He shouldn't do that. She go, "What did he die of?" I said, "Well, it doesn't say what he's died of, but that's just we don't want to see those sort of announcements. We want to see people living their 80s and 90s and living well." Tom, this has been a great topic, and it's a topic that we must continue talking. We must spread the word. If anybody wants to find out more about this and about how they can get in touch with you, what's the best way?
So my email is very simple. You know my name. It's tom@tomlarkin.com. That's my email address. And my website for my course is oralsystemicmastery.com. And there's a contact page there, and that has my courses. And I do a lot of stuff virtually. So if a person can't come live, I do a virtual training in a lot of the entities that we talked about. So I'm trying to be all encompassing and, kind of meet the demands of the modern education platform.
Well, that has to happen. Now, you also mentioned that you do an annual conference.
Yes.
When's that next year?
April 24th and 25th here in Lexington. Yes, it's my annual conference.
All right. Okay. Well, Tom, thank you very much for your time this evening, your time. It's been great having you as a guest, and I've really enjoyed talking to you, and thanks for opening up the eyes of my viewers and listeners. It's been a pleasure having you on the Ultimate Dental Podcast. Thank you.
Thank you so much.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.